Good morning. We're just a few minutes away from getting started. We've got several people logging on. My name is John Green with AMBA, and welcome to the MRTA sponsored education series on emergency medical transportation. My co-host is Bo Carr today, and we welcome you. Just get comfortable. You're in a listen only mode right now. As we get going, if you have any questions, you can use the chat feature, and Bo and I will be monitoring that for you. If you want to, and you're able to, and you're on a laptop or a computer desktop, you can see that QR code there in the bottom right-hand corner of your screen. If you want to take your cell phone and open up your camera feature, just like we do kind of with menus in restaurants today, you can hover over that QR code with your cell phone camera feature. It will pop up a little bit of an information form. And there's no need to do anything with that now. But as you go through this conversation today and you have questions or you want more information, that's the best way to get in contact with us. And then we have representatives that can give you a contact, give you a shout out all across the state and take care of any questions that you have. So looks like Jim is joining us, and we'll get started here in just a few minutes. So I hope things are going well for you. But again, appreciate you joining us, jumping on our call, and we'll get started here in just a few more minutes after we get more folks signed on. Thanks a bunch. Good morning. We are straight up 10:30. My name is John Green with Association Member Benefits Advisors. Thank you for joining us today on our educational series sponsored by the MRTA. We're going to talk about emergency medical transport this morning. I am joined by Bo Carr. He is our co-host today. He'll be monitoring the chat feature. If you want to use that chat feature, depending on what type of device you're looking at, it could be up in the top right-hand corner. It could be on a little toolbar at the bottom. Feel free to jump in there, ask any questions that you have. We'll be taking periodic breaks in there. Bo will jump in, and if we have a general consensus of questions, we'll answer those as well. If you're just joining us, thank you for taking time out of your morning this morning. And you'll notice a QR code down there in the bottom right-hand corner of your screen. That QR code operates just like they do in some of the restaurants during COVID times, where you go in, you'd open up your camera feature on your cell phone, hover over that QR code, just like we do with those restaurant menus, and it will pop up a little bit of an information form. Just simply put your information in there, a couple of checkbox opportunities for any questions. We can get back to you specifically on those questions individually. We have representatives all throughout the state that can answer those questions, cover the benefits that you have with MRTA as well. So be glad to do that for you. We are joined this morning by Jim Kreider. Good morning, Jim and staff. Thanks for joining us this morning. I hope things are going well for you.
Good morning. It won't let me start my video. It says somebody's stopping me. Can you help me here?
Well, I don't know who doesn't want to see your lovely face, so I'm not sure who would be stopping you. Is that Sarah or Kayla up there doing that? Because I don't have that power here. So let me see if I can set it up in my go in the panelist screen here, and I can undo that. Let's see here.
That's the host that stopped it. What does that mean?
That's probably me or Bo. So I don't want to do that at all. So let's see if we can. Oh, I think we have lost Jim. Bo. I don't see him on here as a panelist anymore.
No, I was gonna say I don't know. Well, we'll have to take a look and see. In case I was gonna say I know if it's helpful. Hopefully you can log it back on here, or maybe we can just get started with some of the introduction.
Yeah. We'll go through some of the introduction stuff, and then Jim can jump up back on at the end, hopefully, and can share with us some of the things, because I think the legislature is just winding down there in Jeff City, and we'll be hopefully have some good news and some let Jim share you with some of the issues that are going on right now. So again, thank you very much for joining us today. My name is John Green with Association Member Benefits Advisors, joined by Bo Carr as my co-host. Here comes Jim back again. We may not have him on video. We'll see if we can work on those issues. But Jim, you want to kind of share with us what's going on as far as legislative issues that are starting up?
Yes. Good morning. Can you hear me?
Absolutely. You're great.
Okay. This is great. First of all, I want to say good morning to everyone that's attending this educational webinar. MRTA is trying our best to provide more benefit services, more educational services to our members. And of course, I want to say I hope that everyone's gotten their shots, because at MRTA, we're going to start in-person meetings in August. We're going to have our annual meeting in September. It's going to be in person in Jefferson City. So maybe we can get kind of back to normal and see our fellow members and leaders again. But the legislature was a very difficult one this year. We didn't get anything we wanted, and we lost an issue when it comes to tax credit vouchers. So it was difficult for public education. There is going to be a newsletter out very soon, hard copy and email, which is going to describe the legislative session to you and give you a full report. So with that being said, MRTA members out there, or if you're not a member, we need you to join us. Strengthen numbers, brick by brick, my brethren, one membership at a time. We're over 30,000 members, but that's what keeps us relevant in the legislature and having some influence on the way things happen, because it could have been a lot worse this year if not for MRTA and our retirees. So with that, again, good morning. Thanks for having me. Thanks for attending this educational webinar. I'll turn it back over to you, John, and I appreciate AMBA. AMBA's one of our new member benefits initiatives in order to get better products, better discounts, product discounts, and insurance type discounts for our members. And they're a nationwide company, and they have a lot of clout when it comes to purchasing products that are high quality at a reasonable price. And so we're glad to have them on board at MRTA. So with that, I'll leave it with you, John. Go ahead.
Thank you very much, Jim. We appreciate you and appreciate the partnership. We want to talk a little bit more about that. Before we get rolling, Just want to kind of introduce myself. My name is John Green. I do work with Association Member Benefits Advisors. My wife and I live just a little bit north of Houston. She's a second grade teacher. I've spent most of my career in schools helping active educators prepare for retirement. And so I'm kind of straddle that line between active educators and retired educators. We have 3 children. We spend a lot of our time in Waco following the Baylor Bears, but I do have a little bit of a Missouri connection. My middle son graduated, got his master's in accountancy just 2 weeks ago from Mizzou. So I love being up in that area and really enjoyed the opportunity to be in Missouri. So Jim, thank you for letting us share today with your group. I want to talk a little bit about, first of all, you as members of MRTA. You receive a monthly pension check from the state, from your school district, however you receive your health care, whether it's major medical, Medicare, from the school district, from the federal government, whatever way that you receive your benefits, MRTA, your association, and association member benefits advisors all work together for your benefit to make sure that those things are protected, to make sure that you're taken care of. And this is how MRTA works for you. Jim and his crew, and 30,000 voices strong, they are watchdogs on your pension to make sure that what you worked for all your career is there whenever you leave the schoolhouse, that you can count on that. They also make sure that the way that the current health benefits work, the way that you receive those benefits, they're trying to preserve those as well. And they want to keep you connected to your local community. That's huge. We want to make sure that you have the ability to stay with those people that you maybe spent your whole career with, or meet new people, but they're like-minded individuals all working for the same situation. Don't want you to be isolated out there. And then Jim's big push, if you've been on any of his Coffee with Kreider conversations or on these calls, we appreciate you joining us back, is that he wants every MRTA member to live to be 100. And part of that is having good health care, good supplemental benefits, taking advantage of all the offerings that MRTA provides for you. And so we want to jump in and talk about those today. The advantage of having benefits with MRTA and AMBA together is, one, it covers those gaps that you may have that aren't covered as part of your state benefits or the benefits that you receive from your district. A lot of folks think, well, I've got my benefits here, or Medicare or Medicaid, or my medical insurance will cover all these things. What we find is that there are several gaps in there. We're going to talk about some of those today. And they're portable. If you maybe left the school district before you were eligible to receive a certain benefit, or when you left the school district and there were some benefits that you couldn't take with you because they weren't part of the retirement plan, these benefits are portable. If you leave for whatever reason, or if you move out of state, you have services regardless of where you are. Another benefit of having AMBA and MRTA together, you can extend these benefits to your parents or family members who are not eligible for your benefits. So by virtue of you being an MRTA member, you have the ability to provide coverage to your parents if necessary, or to those adult children who have aged out of your benefits, but maybe not have access to benefits on their own. And the biggest reason why that I see whenever I talk with members of associations all across the country, having some of these benefits can prevent you, or maybe one of your children, a loved one, from having to take extended time off to care for a loved one, because there's coverage there that provides that. So we're going to talk a little bit about that, but we really want to talk about today an issue that is plaguing individuals all across the country, and specifically how it impacts Missourians in regards to emergency medical transportation. So our goals today, and the goals as part of this education series, and if you join us on the long-term care call, we appreciate you joining us. We had a phenomenal response, a lot of questions. We're going to bring that long-term care call back. If you want to take advantage of it, go out to the MRTA website, go look out there. There's a link to that recorded call. You can kind of get a preview of what we're talking about there. But we're going to talk about the issues and the cost of emergency medical transportation in Missouri, across the country, across the world. We're going to take a look at where you can receive your best care in Missouri and how that presents an interesting and unique challenge overall. We're going to discuss the myths and realities of what your insurance covers and what Medicare covers towards any type of ambulance service, any type of emergency medical transportation. and what happens in that ambulance could be covered or not covered, so that you've got peace of mind and you can take advantage of the MRTA endorsed options that you have available to you. So let's go ahead and get rolling through here. You've noticed lately, if you've watched any news, if you've gone to the grocery store, if you've gone to the gas station, and especially if you've gone to any lumber yard, Home Depot, something like that, inflation is going up significantly. The prices of those goods are rising significantly. And unfortunately, the cost of emergency medical transportation is going up even higher. And you have that issue then combined with the same problem of individuals over age 60 are greater users of emergency medical transportation. And it creates an out-of-pocket expense issue that is really hitting people when they least can afford it. And you see in this graph here that's provided on the right-hand side, 30% of all emergency visits, and I want to call them emergency room visits, it can be emergency room to hospital, whatever it is, are by patients arriving over age 60 in some form of an ambulance, be it a ground ambulance, air ambulance, transportation, something like that. And the older we get, the chances are using that emergency transportation grow quite a bit greater. In Missouri, I looked at it, doing research for this, same issue you've got in Missouri. This NPR article that I watched and listened to and read talks about the costs that are going up for emergency transportation. I pulled out some quotes out of there. You see $100,000 for out-of-state transportation for encephalitis to another hospital that can treat someone. $25,000 ambulance bill after getting kicked in the eye by a horse. You see $24,000 for an auto ambulance. It all adds up. There were $26 million billed to Missourians just by air ambulance providers, not ground ambulance, just by air ambulance providers just a few short years ago. And my wife and I, as we were traveling from Kansas City to Columbia a couple of weeks ago for my son's graduation, my wife pointed out in the middle of a field, out in the middle of nowhere, and everybody's familiar with that drive from I-70 across the state, there was an emergency helipad out there. And she said, I wonder where the closest hospital is. Why would they have that out there? And I got to thinking, well, where are some of these hospitals? And I got thinking, well, who needs the transportation? A study by the Health and Human Services Department showed that it's about 60-40 split, male versus female, using the emergency medical transportation, about 60% female versus 40% male. And the top 5 reasons that retirees need emergency transportation. Number 1 is heart attack or stroke. Number 2 is some type of accident, whether it's car accident out on the farm, at home, something like that. Neurological disorders is climbing, whether it's disorientation, something related to the brain. Large number of people needing to be transported that way. Respiratory distress, and then falls. Those are the top 5 reasons. So when you go to a hospital, hospitals are graded out into trauma centers. There are level 1, 2, 3, and 4. And level 1 is your best. It's got the best services. It's got the best equipment, highest trained doctors. They're on staff 24/7, all that kind of stuff. As you go down the level of trauma care, 2, 3, and 4, you see you lose either access to equipment, access to specialists. Some are on call. Some have the ability to stabilize the patient, then move them on. The bigger issue is the further you live away from one of these hospitals and the more major the trauma care is, the more expensive that transportation cost is. And that's why we're talking today, because when you look at Missouri itself, there are 118 hospitals in Missouri. Of those, there are 68 counties, rural counties, that have hospitals. There are 41 counties in Missouri that have no hospitals at all. There are only 10 level 1 trauma centers in Missouri out of a total of just 29 trauma centers, period. Where I live north of Houston, I live 1 mile away from a level 1 trauma center. I live 3 miles away from 2 other level 1 trauma centers. Then I live 15 miles away from 10 other level 1 trauma centers. Level 1 trauma centers where I live is not an issue. In Missouri, you can see, depending on where you live, that can be an issue. You've got your concentration in St. Louis, and you've got your concentration in Kansas City. It gets to be a little bit sketchy after that. So that usually means that if you're transferred to a non-level 1 trauma hospital because of where you live, and you need advanced care or more services, that means that you have to be transported to another hospital. That usually ends up with 2 transportation bills. And most of the time, 99% of the time, you don't get to choose who takes you in any type of emergency transportation. So people think, why is this not covered by my insurance? And I will tell you, this is from personal experience why it's not usually covered. I'll share that in a moment. I'll share with you some other issues as well. But usually, if it's a group policy that you have through your district before you get Medicare, they usually will pay only usual and customary charges. 85% of ambulance networks or emergency medical providers are not part of networks at all. So they don't have to go by usual and customary. Medicare language is very tricky, and I'll share with you that in a moment. They'll talk about may pay for something, and if a provider charges more than the schedule allows, then you're responsible for the difference there. And then Medicare will go back and look and say, well, that emergency transportation that you received, based on what you had, you really didn't need to take an ambulance. So they're not going to pay for anything at all. So, but you don't know that whenever your neighbor calls, whenever a child calls, when you call for your spouse, you don't know what that issue is. And so that's why some folks think that even with insurance, they're covered. Really, with insurance, you could be exposed even more. We're going to pull some of our facts straight from the Medicare and You handbook. I will tell you, if you have insomnia, I would highly encourage you to download this presentation or download the Medicare book. Read that at night. You'll make it in about 2 chapters, and then you'll have no problem sleeping after that. But on page 31 in section 2, it talks about ambulance services, and it talks about what Medicare covers, how they cover it. The biggest things I want to point out, and I've highlighted there in yellowish orange, they may pay for emergency medical transportation. They may pay if you have to be transported based on a doctor's note to get certain type of treatment there. And then even if they do pay, you may be responsible for 20% of the Medicaid approved amount, Medicare approved amount, and the Part B deductible applies. And we've got a Medicare education seminar coming up next Tuesday. If you want to find out the ins and outs of how Medicare works, we're going to absolutely tell you all about that. But the biggest thing that I want you to take away from this is in the Medicare handbook, they are telling you right off the bat, they may pay for it. That's never a peace of mind that I want to have to deal with. And whenever I call for an ambulance or need an ambulance, I don't want to have to wonder, may they cover this? This may or may not be covered. So it's important to understand that. There's also 2 different types of services or treatments, or however you want to call it, care that you will receive in an ambulance or in an air helicopter. One is called BLS, which is basic life support, and one is ALS, or advanced life support. There are significant differences between the 2. Think about this. You may have a fall at your house. Your neighbor finds you and they call the ambulance. The ambulance comes out depending upon who is on that ambulance. You can have a basic EMT or you can have a paramedic. Different ones are different certifications, different abilities. They cost different. They bill differently. The basic level services there, basic life support services, as you see there on the left-hand side, those type of things, those are usually covered by Medicare. Those services you receive in the ambulance. If something has to happen where you get advanced life services, those are not covered by Medicare as part of this ambulance treatment. So if you've got to have an IV hookup, or they hook up an EKG to monitor you in the ambulance, those things are not covered by Medicare. So it's important to understand. And again, when this is happening, you're not making the call on whether these type of treatments are done for you, these type of services are done for you. And so it's important to understand what is covered, what is available to you as well. You can't prevent those things from happening. You don't know when an accident's going to happen. You don't know when a heart attack, a stroke, or a need there. The biggest thing that MRTA and AMBA want you to know is that you can be prepared when and if they do happen. So we'll go ahead and jump on off in here. I want to show you a couple of real life examples of ambulance bills and show you just how far the transportation took place. Share you a story of mine. We may have a representative on from AMBA that's got a real life experience in Missouri. Since we are newer to Missouri in terms of our relationship with MRTA, we don't have any testimonials, but I want to show you some testimonials from some of our members that have taken advantage of this, and we'll walk through this. But you see this top bill up here. This is the cost of a real ambulance for 20 miles. Just to dispatch the ambulance was almost $1,300. On top of that, they had mileage charges. So you see in there, it was about $1,700 of total charges. Blue Cross Blue Shield, which group insurance, paid $374 of that. That left our member on the hook for $1,343. Well, 20 miles could be a long way in Missouri, could be a short distance. You jump down and you see there just 9 miles, and still the cost is $1,400, $1,500, still a charge on there, a balance bill of $1,000 that's responsible for the individual. Going 4 miles, $1,300 is the cost for being transported 4 miles. My son, that picture that I showed you back there earlier that just graduated from Mizzou, when he was 12 years old, he ended up in a Pee Wee football game being hauled off the field on a stretcher into an ambulance. Didn't know what was wrong with him. He couldn't move on the field. They called an ambulance. They took him 4 miles to the local hospital. He was 12 years old. They diagnosed him with a bad situation of cramps, $1,500 bill, because the medical insurance said it was not necessary for him to be transported in an ambulance. Didn't know that because he couldn't move. Even 4 miles, $1,500 cost to us. Now you look at, like I mentioned, I have a level 1 trauma center right across the freeway from me, a mile away. Helicopters constantly landing on that hospital. This is an example in California. Just to start up the helicopter to go pull someone was $4,100, or excuse me, $33,000. Excuse me. It ends up being a total charge of $41,000, of which Blue Cross Blue Shield paid $33,000, and they had a balance due of $8,300. Again, a pretty good hit to the system when it comes there. So the answer that we have, and this is an endorsed benefit that we have through MRTA, is MASA. It's the Medical Air Services Association. It's got air in there. It's ground, it's air, it's anywhere. And what MASA is they've been around since 1974. For 47 years, they've been taking care of families. They've got an A+ reputation through the Better Business Bureau. They staff many of their air ambulances, many of their airplanes. They staff many of their services with registered paramedics, nurses, physicians, top-notch individuals. They are all over the world. But the biggest thing is there is $0 limit for your emergency transportation cost. So if your local hospital, you transport and the local ambulance services come, it's no cost to you whatsoever. So that's the benefit of being an MRTA member in this program. These are a couple of examples that I want to share with you. This was an example in Dallas, right outside of Fort Worth, a little town called Azle, not very far from the hospital, but because of rush hour traffic, husband had a need for an ambulance service. They air flighted him or lifted him just a few miles away. It was $25,000. MASA took care of the whole bill, took care of it 100%. Here's another situation. This was a member, and the summer's opening back up. This is the teacher that when she retired, she says, I'm going to hit the world. I'm going to travel the world. She went down to Mexico, fell off of a pyramid, a ruin, one of the structures down there that you go on tours, fell off. She had to have multiple surgeries. They couldn't get her legs set right. They had to use an air ambulance which is a flight back to the States. Pretty significant. MASA coordinated everything, took care of her, flew her back to Denver in a Learjet, took care of her family. The whole 9 yards, covered 100%. Again, this is a service that you have available to you. We're going to talk about that. These are a couple of other examples a little bit closer to home up in Wisconsin. Some recommendations, not realizing what would happen, having parents transported. They were able to take care of the bill, didn't have to worry about it at all. The nice thing about this is not insurance. This is a membership program. Once you become a platinum member of the MASA program, all you have to do is fax in a bill. They take care of it. There's no claims to file, anything like that. You just simply fax that bill in and it's paid. And they appreciate what we've done. You don't have to worry about any type of medical debt. And that's a big issue. And Jim talked about it, being able to live to age 100. You also don't want to outlive your money. And you don't want to have any type of medical transportation issue mess up your funding that you have for yourself. So let me see if if Kyle has joined us. Doesn't look like Kyle has joined us. He's going to give us an example of something else in Missouri, a little bit closer to home, because he's been able to take care of some customers a little bit closer to home. Again, just some more examples here. Air ambulance, a situation down in Florida that they had $58,500. MASA paid the whole thing, dealt with it over the phone. Another one, mother taken care of, had to go to the ambulance, had to go to the hospital in an ambulance. This member didn't have to worry about it because their mother's bill was taken care of, not worrying about anything at all. So a nice feature there. So what does exactly MASA do? A platinum membership in MASA, and this is what you would have available to you, is a supplement to your health insurance. Again, it is not health insurance coverage. It's a membership benefit that gives you financial protection in any life-saving emergency that you need, any transportation that you need, 100% of the time, either at home or away from home. So it doesn't matter where you are. We've all been at home the past year plus. People are starting to get back out. People are starting to get back all over the country. Maybe go down to the Lake of the Ozarks, jump off a cliff, break your leg, emergency transportation taken care of. Go to Disney World with the grandkids, something happens down there, you're taken care of. We can take care of you that way as well. Bo, do we have any other questions that have popped through recently before we move on?
Yeah, so Danita is asking about MASA in particular and cost and that sort of thing. And today for the educational webinar, I don't know that we're getting into the details of the program, but we can definitely send out that information, and connect you to somebody so that you can see, because there are a few different plans that are available, and this is the MRTA plan. And so John, at some point, I know that QR code is probably going to pop back up in here, and then I'll put your email address in here too. But anybody who wishes to get that specific information for MASA, that's the MRTA benefit. We can definitely just raise your hand and we can get that to you for sure.
Right, and we're going to touch on the benefits as far as the coverage. We're going to talk a little bit about the special nature of the MRTA program and some of the discounts and features on that. If you've got questions, I know we've got some folks raising their hand. Bo's going to get with you on the chat feature because that'll make it a little bit smoother to roll through here. But we'll roll through and talk about this and kind of explain the nuts and bolts of the MASA program. Again, it is not insurance. This is a supplement to your health insurance. It is a membership program. The good news about that is it does not matter what your health is. You don't have to worry about that. There's no age requirements, no health requirements, anything like that. You get emergency air transportation, helicopter transportation, ground ambulance transportation, repatriation and recuperation. Say you go see grandkids in Florida and something happens to you down there and you get treated down there, but you can't drive back to Missouri. You've got the ability with MASA to repatriate you. They will take care of getting you back home. Non-injury transport for the other members in your party, or escort transportation. If you're out say you're on a trip with a bunch of other retired teachers and you're going to Europe eventually, and you're looking around the Colosseum in Rome and you happen to take a fall, but your trip group moves on. They'll provide an escort for you to get back to where you need to in that. If you're down again with Disney World, took your kids to Disney World, or even just down to Branson, to Silver Dollar City, they will take care of your minor children, your grandchildren to get back. They'll take your car back if you returned. So, I mean, there's lots of different things that they'll cover for you, and it's worldwide coverage. You don't have to worry about anywhere that you are. You've got coverage with this program. So, Bo, I see the lots of lights flashing and stuff like that. Are there any more specific questions about coverage?
Yeah, it's good. No, it looks like everybody's finding the Q&A and chat. So whichever one, I'm getting quite a few in here. Here's a quick question I thought was good that probably applies to several people. I've been replying back to some specifics within the chat here, but Colleen asked if she currently pays a couple of different membership services because she lives somewhere rural in Missouri. And so first of all, that's definitely a smart move. So it sounds like you're on top of it. Her question is, would I need to continue those memberships with a MASA program?
That's a great question. I used to work in Rockport, Texas, and it's a small little coastal community near Corpus Christi that does not have any type of hospital other than just a walk-in, stitch-you-up type clinic. People there in the community raise money and pay a membership to their particular life flight feature. It allows them to get from Rockport to Corpus Christi about 45 miles away. That's something that I would continue to support because it's part of my community, but it didn't cover anything beyond just getting to Corpus Christi, to that level 1 trauma center and to the hospitals there. So you'd have to sit down and look at it. At the end of the presentation, my email will be there, a QR code. We have representatives all over the state, and we can sit down and see what's best for you, because you never know. I mean, nobody ever plans to go in an ambulance ride anywhere. But again, it depends on your situation. The thing about MASA that I like, that I don't have to worry about, am I just local covered? Am I just the States, United States, Canada? I'm all over the world. I've got coverage everywhere. So that's a really interesting question and a very popular one. One thing I do want to point out that's really, really cool, we have monthly memberships that are less than the cost of a cup of coffee. There are 5-year and lifetime memberships, depending upon what's best for you and your family. When you get a 5-year or a lifetime membership, you get an ID bracelet. And whether you want to wear one, you can put it on your Apple Watch if you want to. That ID watch, the My ID bracelet, and your representative will help you set it up. You can put in all of your medical information in there, all of your medications, your contacts, all that kind of stuff, so that if somebody comes to your house or wherever you are and a paramedic picks you up and puts you in the ambulance, they can scan that QR code. They can call that number with the ID and the PIN. They'll know all about you immediately. They're trained to look at those numbers, just like the Med Alert bracelet my grandfather used to wear because he was allergic to penicillin, not to give him any penicillin, that type of thing. This is just like that. You get this free with your 5-year and your lifetime membership so that you can have this anywhere you go. You don't have to worry about any issues. They know who you are. They know any medications, anything you're allergic to, any type of treatment plans, as well as how to get a hold of you. So that is a great feature that comes with this. Okay, so why do you need MASA program? We've talked about a lot of different things. We've talked about the best coverage available if you're a traveler. If you're not a traveler, if you need ground or air, it's available to you. The special benefits that you can get through MASA, through MRTA and AMBA are related to a significant discount for members of MRTA, and they waive the membership fee. So just the cost of MRTA's membership, you'd save that right away because they're waiving the membership fee to MASA. Bo, I see a lot of popping up questions. We have any new unique questions? Or is that you communicating back and forth with individuals?
I think in one of your upcoming slides here, this QR code's coming up. I'm getting quite a few responses just on how to get, because we do have brochures and information,
Okay.
and can connect you to some folks who can answer your questions,
Right.
individual questions as well. Yeah.
Right. Yeah, we've got that coming up. One last thing, because you are an MRTA member, and this is a really nice feature. Nobody loves dealing with claim paperwork. Nobody loves filling out forms and all that kind of mess. As an MRTA member, all you have to do when you get an emergency transportation bill, send it in, it's paid. 100% taken care of. You don't have to worry about it. There's no claim forms to fill out whatsoever. So here's the QR code that Bo mentioned. We talked about this QR code. You use it just like a feature in the restaurant where you're looking at a menu. Take your cell phone, open up the camera feature, hover over that QR code. It will pop up a little information form. Just plug in your information in there. You can go down and you can select MASA, emergency transportation, medical transportation. Select that. There's other topics if you want to talk to someone about that. We will have someone give you a call right away. If you're on your cell phone and you join us on your phone today, you can send me your name, phone number, and your email address to my email, jon.green, like the color, at amba.info, info, john.green@amba.info. Just send me your name, email address, say, hey, I was on the call today, and I'd like more information. We'd be glad to get it to you. Again, we have at least a dozen representatives all across the state in certain geographies that can take care of you, that will give you a call, sit down, show with you. We can do it over Zoom just like this. We can do it on a phone call, lots of different ways to get you information to help you understand what's available out there to you, and how you can get involved and become a member in this. Because the last thing that I want to see someone do is start to enjoy travel again and have finances wrecked because of something that does happen that way. So I'm going to leave this up for just a few more seconds. I'll go back to it because I want to share with you a couple of things coming up on our educational calendar, and then we'll close it out here. We've got 2 more of our series in this abbreviated series. Then we'll start this back up later in the summer. We've got Making Sense of Medicare coming up next Tuesday at 10:30. I would highly encourage you, if you want to introduce someone to MRTA that is not a member of MRTA, bring them to this workshop or this webinar, because we're going to kind of break down what Medicare is, what it covers, what it doesn't cover. We're going to talk about Medicare supplements, how those work, that dreaded donut hole, show you where those gaps are, things that you can be aware of, and show you what the last 10 years of Medicare cuts has done to what I would consider an insidious rule that's happening now in what's called observation status. So write down observation status. Grab a pen and paper and write down observation status, because we're going to talk about that next Tuesday. When I found out about this, it really shocked me, because it is a way that Medicare can get around from paying for certain procedures. And so we'll talk about that. So write down observation status and remind me of that when we talk next Tuesday. And then June 3rd, one of our favorite things to talk about is all the fun perks, all the fun discounts of being an MRTA member. Again, so this is an opportunity for you to bring someone into the webinar and say, hey, here's all the cool fun stuff, whether it's trips, restaurants, shopping, things you already use at home, memberships to Costco, Sam's, things like that. Lots of things we're going to talk about, perks that you have through MRTA membership, how to take advantage of them, what some of the things are hot out there. If you want to go see a Cardinals game or a Royals game, tickets are dirt cheap, that kind of fun stuff as well. So jump on those calls there. I'll go back real quickly before we end up and give you that QR code again. I've gotten my phone's going off with all the folks sending in their QR codes, their information. Again, hover over that with your camera. If you just don't want to do that or don't have the ability to do it with your camera feature on your phone, all you've got to do is email me, John, JON.green@amba.info. Your name, your phone number, of course, your email address will come through. We'll get someone to take care of you, answer any questions. Thank you for being on the call today. Bo, are there any other questions that have popped through before we want to wrap it up here?
No, it's I'm getting some thank yous, so I appreciate everybody hopping on today. And yeah, it's definitely a very important topic. And again, we're really happy to partner with MRTA, and yeah, this is really exciting. So definitely, we've got some other webinars coming up. Let your friends know if they're not MRTA members. It's fine, have them join the call, and we'll help you bring in some more members into MRTA. We understand that membership is the lifeblood of the organization. So definitely appreciate the partnership.
Absolutely. Jim, thank you very much for allowing us to share some of your time today. We appreciate the partnership. And again, the more people we can get to know about MRTA, the stronger it is next time the legislator visits. And we'll hope to see you all and talk to you all next Tuesday and then Friday a week from then, or Thursday a week from then. So Jim, any last words you want to share with the group before we sign off?
Well, I just want to thank you, gentlemen, and thank everyone that participated today. We hope this was beneficial. A lot of good information, and we do want all MRTA members to live to be 100 years of age. That is our goal. So join today, because if you're not a member, you might not make it to 100.
Strong words, Jim. I appreciate that. Everyone have a great day. I'll leave this QR code, my email address up, but thank you again. Thank you both for joining us, being our co-host and navigating the ship for us. Jim and staff back in the MRTA headquarters, thank you very much. And we will talk again next Tuesday. Y'all take care.